On the call today, we're going to start over. We have myself, Leanne Jones, and again, I am the database manager for the General Thoracic and Congenital Databases. We have Carol Crone, Senior Clinical Manager for the STS National Database, as well as Jane Hahn, the Associate Director of Quality for the STS. From Iqvia, we have Melanie Betts, the Lead Business Analyst, and some of her fellow Iqvia colleagues. So if this is your first time joining us on a user group call, I wanted to provide just a real quick overview for the purpose of the user group calls. These user group calls are used as a forum where we can talk with one another to share experiences and ideas on how to improve, hear how things are going with the transition from your perspective, and most importantly, you have the opportunity to ask your questions with Iqvia on the line and get feedback immediately. So we're here to listen, and the sole purpose of these user groups calls is to listen and to get your questions answered. All right, next slide, please. So for the Fts updates, due to these unprecedented times, the 2020 AQO meeting will be going virtual. I hate that we won't get to see everyone in person, but unfortunately we are just having to roll with the punches and adapt with the times and the current pandemic. More information about our virtual AQO will be coming soon. The May training manual is being updated and will be posted within the first week of May. Just also a reminder that the updated 241 data collection forms were posted and are available to you out on the website. These updated forms and the training manual include the new COVID-19 variable. And again, I'll touch more on the new COVID-19 variable here in just a minute. We are continuing to work with the General Thoracic Surgery Database Task Force for the next data version upgrade, version 5.21. The task force had another great call this week, and we are getting close to finalizing the complications updates. Our goal is to have the data collection form ready for beta testing by the core group within the next couple of weeks. And as of right now, we are currently still on track to go live January 2021. Next slide, please. So next, I'm just going to hit some COVID, go a little bit over the COVID-19 update. Next slide, please. All right. I'm sorry, let's see here. So since we have implemented the new COVID-19 variable, we've had some additional points that we'd like to clarify. This info will also be included in the training manual for the May update. So when to code no and when to code yes. So we would code no for patients who are not tested, and you would also code no for patients who are tested for COVID-19 and that test is negative. You will code yes for patients who test positive for COVID-19 and then prior to hospitalization for the surgery, in hospital prior to surgery, in hospital after surgery, after discharge, within 30 days of surgery, patients who report they tested positive for COVID-19 after discharge within 30 days of surgery, and then verify that the test was specific to COVID-19. And if the patient was tested within 30 days, but the result comes back after 30 days, still code this as within 30 days. Carol, do you mind if I share my screen?
Nope, go ahead. Let me stop sharing.
Okay.
Okay, Leanne, go ahead. Sorry, everybody.
Okay.
Sorry. We are not disorganized, I promise.
I know. All right. Sorry.
There you go.
Okay. All right, everyone. I'm going to back up to this slide here. So I apologize. Again, I sincerely apologize for all the confusion. As Carol said, we are clearly typically not this unorganized, but I am clearly having technical difficulties today. Okay. So as you are aware, the STS has added the new COVID field in order to collect data on COVID-19. So STS did activate the use of the temporary coded field, temp code sequence 4080. So per the data specifications, the temp fields should not be used unless expressly instructed to do so by the STS. And for the thoracic database, we have activated sequence number 4080 to answer the question, did the patient have a laboratory confirmed diagnosis of COVID-19? In the past, we found that participants have been using this temporary field for internal purposes. Again, you should not be using these temporary fields for your own purposes, just for this specific reason, in case STS decides, hey, we need to use one of those temp codes. So we've inactivated that. So because we have seen some data in these fields in past harvests, STS has chosen to implement harvest codes 10 through 14 to answer this COVID question. Until vendors can get the text, the actual text added to your software, no, the patient did not have a confirmed library diagnosis, or yes, prior to hospitalization, yes, prior to surgery, for example, you will need to enter the actual harvest number into your software. So this would allow the vendor, just by entering that harvest number as a 10, 11, 12, 13, or 14, this will allow the vendor to map those responses to your software once we are able to get that updated. We have gotten a couple of questions from participants regarding how to answer this specific question in their software. So as you can see here, we've provided a couple of examples of some of the vendor software. So this example here from one of the software vendors, the participant had actually checked yes to temporary yes, no field number 1, and then entered the date the test was done and entered the temporary code 10 for no, the diagnosis did not have a confirmed diagnosis, and had entered COVID-19 in the temporary text field. Please note that we do not want you to answer anything in these other temporary fields. The only field you should be answering is this temporary coded field, and then you should just enter the harvest code. And here's another example from another vendor software. Again, we don't want you to answer sequence 4050, sequence number 4060, 4070, or 4090. You should not be putting anything into those temporary fields. The only field that you should be populating is this temp code 4080. All right, in terms of coding for the coronavirus, excuse me, in terms of coding for the COVID-19 variable, we wanted to identify the common strands and other human coronavirus strands that are being tested. Please note that the only strand to be collected for the STS databases is the SARS-CoV-2, the novel coronavirus that causes COVID-19. This is the only strand that we are looking that should be coded for in the STS database. All right, and again, we'll go back to this slide so I can cover a little more, go through it a little more simply. So since we haven't implemented this COVID-19 variable, participants want to know, when do you code no, when do you code yes? Code no, again, for patients who are not tested, and also code no for patients who are tested for COVID-19 and that test is negative. Code yes for patients who test positive for COVID-19 for prior to hospitalization, surgery in hospital, prior to surgery, after discharge within 30 days. Code yes for patients who self-report they tested positive for COVID-19 after discharge within 30 days of surgery, but you need to verify that the test was specific to COVID-19. And also code yes if the patient was tested within 30 days, but the test results did not come back until after 30 days. Still code this as within 30 days. All right, so what about Pfts? This is an excellent question that we've gotten from several of you. As you are aware, the pulmonary function test performed sequence 1910 is a required field for record inclusion. As we know, Pfts are more difficult to obtain at present times due to either the labs closing or due to minimizing patient exposure to the hospitals and clinics. The STS, National Database Surgeon Leadership and Task Force are aware of this issue and will be taking this to account we'll be taking this into account. So programs will not be penalized for not obtaining PFDs during this challenging time. So what we're asking is that you please code no for PFTs performed and then select unable to perform as the reason why. So again, please code no and then code unable to perform as the reason the tests were not performed. And again, this information will be updated in the training manual that will be posted for May. Next, I'm going to turn things over to Melanie Bent, the Iqvia Lead Business Analyst, for our Iqvia status update. Melanie?
Thanks, Leanne. And hello, everyone. Good afternoon. Let's take a look at a couple of items that we wanted to share with the group. The first item is related to a recent patch that went out and was deployed on Saturday. This impacted not all users, it was a subset of users, and it was specific to the fields that are identified on this slide. The impacted sites were notified, and it was specific to files that were uploaded after April the 4th. If by chance you did not get a notification and you did encounter this, because we did have some bounce backs from some emails, so just in case if you did not receive a notification and you also encountered this issue where you uploaded and saw critical errors related to these fields, please go ahead and re-upload those files. And again, it's specific to files that were uploaded after the April 4th timeframe. Okay, so just wanted to call that out. This information is also posted within the notification section within the platform so that you have reference in regards to the field names if you need to go back to review those. Okay, so let's go to the next slide.
Here we go.
All right. Just a general update in regards to where the current items that are still being reported. We are still encountering issues, and this is on a site-by-site basis, and we do still need, if you do encounter this issue, we still do need you to reach out to our support team so that we could review the files to review and see what would be occurring. This is not happening for all users, and in certain instances there are different characters that may have been entered into a field where it didn't expect, where it's basically dropping that record, and you'll see that change in number when you upload the final file. So we are asking that if you do see this issue or experience this issue, if you can reach out to our support team to notify, and that we could go ahead and review the DAT file. Another item that has been occurring is related to the file structure issues, the file structure errors at the time of trying to upload. Again, it is specific to files. We are looking at ways to be able to provide better feedback, but at this moment, we still are asking you to go ahead and contact our support team, and usually what we would have to do is just do a review of the file, identify where that file structure error is occurring, and then have you upload again, or if you need our support team to assist with the upload, we could do that also. Okay, let's go to the next slide. So we're continuing, again, based on feedback that we're receiving, just in regards to validation checks. We had, with our last update, there were changes and updates to certain validation messages. We still have additional items that we have confirmed that we will be updating. So those are planned for future upgrade. We are looking to target that upgrade hopefully sometimes towards the end of potentially May or June, but we will be sharing more information on the specific list of those validations and those corrections, and we'll be posting information within the notification section of the platform. Other updates in regards to corrections for the MBR, we do have items that were reported where the 2.3 data variables were appearing where within a report reporting timeframe where we would only expect the 2.41 data variables to appear. So we did have a couple of reports on that. So we've identified fixes for those. Again, we would be planning on including those within that future upgrade. And then there were identified dashboard calculations. Those also have been identified, and those would be included. The full list of those reported STS IDs will be posted within the notification section once the update has happened. So I did not include that here, but it will be available, the full list of those specific items. Another item that was raised is related to the race documented, where it was being flagged on the MBR. So there's logic consideration that needs to be implemented there. Again, we have that identified, and that also will be included in regards to the race documented correction. So that is, yep, all of the items that are covered here. So let's go to the next slide. And enhancements. So we are looking at enhancements. We did meet with the STS team maybe about, it's probably been about 2-3 months, where we received feedback from STS and also from data managers. And of course, support has gotten those requests also. We're reviewing through those items and looking at doing enhancements, of course, to the reports related to the dashboard. If there's any additional variables that need to be included, that should be included, we will be reviewing those and updating the dashboard. So that is definitely on the roadmap to add as an enhancement. And then the layout for the missing variable report, we've already added the short name column. So that's already available and in production. So that was an item that was requested, highly requested. And so that's already available. So I actually should have put a little check next to that. That's already done. And then there is an additional update that we will be doing to the missing summary section of the missing variable report. So there's, again, based on feedback on how the layout of the report, would be a little bit more user-friendly. So we have more things that we would like to go ahead and implement. And then going back up, because I skipped it, it's the uploader performance enhancements. We do have some enhancements that will be going in within actually the beginning of May that are related to some enhancements related to processing for validations. So that will be coming. And again, once that's done within the environment, we will be posting a recap of those and the expected improvements so that you're aware of what's being done within the platform. And I believe this is the last slide. Let's go to the next one. Yep. So do you want me to cover this, or do you have this one, Leanne?
I can cover this one. That's fine, Melanie. Thank you.
You're welcome.
All right. Thanks again, Melanie, for the update. All right. So here, we've gone over this several times before, but I just always like to include it for anyone that's new to join. This is the Iqvia support plan. Once participants, or if a participant reaches out for needs support, you would contact Iqvia customer support via the phone or email located here. Once you contact support, you'll be connected to Iqvia's Tier 1 support. Tier 1 will answer your questions. If Tier 1 is unable to assist in your question, they'll route to either a Tier 2, Iqvia Tier 2 support team member, or if the question is STS related, they'll route your question to STS. STS, if we are unable to answer your question, if it has to do with a specific analysis, we'll route the question to DCRI if necessary. Also, if Tier 2 is unable to answer the question and it has to do with software issues or things like that, Iqvia Tier 2 support would reach out and work directly with your database vendor to help get a resolution for any issues. And also, this Iqvia support plan is posted out on the STS website for your convenience as well. Next here, I have provided a listing of resources available to our participants. As always, please do not hesitate to reach out to me directly with any additional questions or concerns. My email address is at the bottom of the screen there. Some great resources are the STS National Database webpage. Again, you do have access to the STS tech support for questions regarding the uploader, the data quality report, the missing variable report, dashboard, password login issues, as well as the phone support number there. And also the STS National Database feedback form is located on the STS website. Please use that form to provide us with any feedback regarding the platform, the transition, anything positive, negative, things we can do to improve, things you like. Please, again, use that form to provide us with feedback. We love to hear from you, and we're always looking for ways to improve. Next, just real quick, I just wanted to thank you all for joining. I sincerely apologize for all the technical difficulties. I'm so sorry for that. So again, as we stated, we're typically not that untogether, so I apologize. Our next general thoracic surgery database webinars, we have our next monthly webinar on May 13th at 1:30 p.m. Central Time, and our next user group call is May 27th at 2 o'clock Central Time, so please get those added to your calendar. I just wanted to go over those dates before we hopped into the questions. So next, we're going to turn things over to open discussion. Please use the Q&A function to submit your questions. We'll answer as many questions as possible. And again, we encourage your feedback and would love to hear from you. So please feel free to submit those questions via the Q&A function. All right, so we do have a few questions that are coming in. So I'm going to go ahead and get started. The MIPS process measures, should we still collect, but they will not be reported to CMS? Are there any fields we should focus on for NQF or just public reporting fields? Thank you. We would like for you to collect all the variables that are included there. I'm not sure. Carol, do you have any input on that?
Sure. Hi, Leanne, it's Carol. The MIPS is for surgeons who are participating in the MIPS reimbursement. Can you hear me okay, Leanne?
Yes, ma'am.
Okay. The MIPS is for sites who are participating in MIPS reimbursement, who use our measures for MIPS reimbursement. Sites should still collect all the fields that we are capturing regardless of our relationship with MIPS next year for the general thoracic database. I think that would be a good answer. Jane, if you're listening, if you're there, do you have anything I know you're listening. If you have anything to add, feel free, but I don't believe that just because we're not going to be submitting for MIPS for general thoracic that we should make any changes in anything else for the data collection. Okay.
Okay, perfect. Thank you. Our next question, if there's no mention in the chart of whether a patient has undergone testing for COVID-19, should this also be coded as no, since there is no unknown option, or should this variable be left blank? So we're asking, as of April 1st, participants collect this variable for all patients. So if they have not undergone testing for COVID-19, please select no for that patient. Do you agree, Carol?
Yes, I agree. That's correct. No is to be collected for patients who are tested and test negative, or for patients who are not tested. The question is, did the patient test positive for COVID-19? So either of those scenarios would reflect a no answer.
Perfect. Thank you. All right. Our next question. A COVID-19 test is done if patient goes emergently to surgery before the results come back. Results come back positive. Do I code yes in hospital prior to surgery or yes in hospital after surgery?
Yeah. I'm happy to take this one if you'd like, Leanne.
Sure.
Sure. So this is Carol. So for this question, whenever the testing was done is when you would code the timing for that testing, regardless of when those results come back. So for this patient that was tested prior to surgery, you would use the option that reflects that timing.
Mm-hmm.
Okay.
Great, thank you.
You're welcome.
We can get that added to the training manual for clarification. Our next question, can you display the COVID screen again that shows how the collection screen should look when adding to the vendor questionnaire? Yes, I can display that. Give me just a second here. And there's the screen there, Jan, up on. Okay. And these slides will be available after this presentation, so within the next day or two they'll be posted up on the STS website. So you can also refer to the slide deck as well. Our next question, this may be an Iqvia one. The DQR report shows what patient IDs that have issues, warnings, or errors. Is there a particular report or portion of the uploader or DQR that details or lists what patient IDs were accepted for analysis?
So this is Melanie. So currently there isn't, well, all of the data was sent to DCRI for analysis. And we're at this point still working with them to determine the actual interface to bring back the data into the Iqvia platform. This was not, off the top of my head, this was not an item in regards to a separate report to display which patients were accepted in for analysis, but this is something that I could note and share with our development team to just get feedback. But this was not an item that we had in regards to the initial sets of reports that we would be displaying once we get the data back.
Okay, thank you, Melanie. Our next question, from date forward, I think it's supposed to say, from what date forward may we code no, unable to perform for Pfts? So Cheryl, correct me if I'm wrong, we're asking for participants to start collecting this April 1 forward. So I assume, do you agree with the April 1 forward, or should we clarify with the surgeon leadership?
We would like sites to, this is Carol, we would like sites to collect this on all cases starting April 1st going forward. However, it is available for sites to collect this with cases as far back as January if they would like, because we know that there may have been some, late January, there may have been some sites that were affected early on that might be able to utilize this field. However, it's not required for sites to go back to January. We would like them to start with April 1st. The option is there if they would like to go prior to April 1st.
Right.
Okay.
So what if the patient is tested at another facility that is not in our EMR?
Yep, that's as long as, this is Carol again, as long as the patient has a COVID-19 test, even if that patient reports to you that they were tested for COVID-19, the surgeon leaders have agreed that that is okay to code that as a positive test. It does have, you would have to verify that it was a testing for COVID-19, because as Leanne had shown, there's quite a bit of strands of COVID that are different from the current novel coronavirus. So it has to be specific to COVID-19 and self-reporting of that to you, as long as you can confirm that confirm with the patient that the test was specific to COVID-19 is okay to code as yes.
Thank you, Carolyn. I put the slide back up for the variety of strands, just in case.
And we'll
all right, our next question.
I was just going to say, Lan, you and I will just have to make sure that we have good clarification in the training manual. As these questions come in, and we aren't always able to update the training manual weekly, so it gets a little confusing if we were to do that. So we save the updates for May, but that's the purpose of these webinars, is to get this information out to everybody ahead of those updates and make sure that we also are aware of any trouble that sites are having with this field, so we can provide that. So we will update the training manuals with this information.
Thank you, Carol. Our next question, if a patient tested positive 30 days or more before procedure, and now becomes negative, how do you code for that, yes or no? Have you guys run into that for the adult cardiac, Carol?
Yep, I'm just going to pull up that choices on the field on my screen. Hold on one second.
Okay.
Do you want to be able to switch over
Yeah,
to
I
the
can pull it up.
Okay, great.
Yes, ma'am.
Yeah, so I would just code the harvest code 11, the yes prior to hospitalization for this surgery.
Mm-hmm. Okay.
The surgeons
right.
didn't give us a time frame on that, but I think that it's fine. What they're looking for is that we've had quite a bit of poor outcomes, seen quite a bit of poor outcomes in patients who ended up testing positive after surgery. They may have not tested the patient prior to surgery because we just weren't there at that stage yet with how sites were reacting to the COVID virus. So what they've seen is that what the purpose of this is to look at any testing of these patients if they did have it and how that may have increased the risk of their procedure. So that's what we're looking for. So coding yes prior to hospitalization, prior to the 30 days at this time is fine. If anything should change and the surgeons decide, in 2 months that we need to make a difference, we would discuss that and be thoughtful in that decision process. But as right now, any diagnosis prior to surgery should be coded as harvest code 11.
Mm-hmm. Thank you. Our next question, can you please clarify the date beginning on which the Pfts will not be required to be collected? I think I missed the answer to the original question. Carol, what are your thoughts on this? I don't think the surgeon task force or the leadership didn't give a specific date on when the Pfts will not be required to be collected.
Sure, I think we probably need to bring this back to the General Thoracic Task Force just to get clarity on this. I would say definitely April 1st, but we know that sites were affected before that. It may not have been performing Pfts on patients, probably March and maybe even as early as February. So we will provide clarity in the training manual on this. I don't want to give an answer and people confused. So.
Right. And again, we'll get some clarity, and as Carol stated, we'll have that updated in the training manual for May. So we'll take that back to leadership and get some more information for you. Our next question is for Iqvia. Melanie, can you shed some more light on how the concepts of analyzed versus non-analyzed procedures and major versus minor filters are reported in the DQR? Is there a portion of the training manual that discusses how the filters work, the DQR filters work?
And actually there is within the platform, it's going to be the entry dated February the 13th. In the notification section, it'll be listed as GTSD update 2/13/2020. There is a write-up in regards to the current way that the filtering is handled. So for the analyzed, and we've gotten more feedback around this functionality, and we've gotten feedback. We want to make sure that the alignment of what's expected on that filtering is working as expected. But right now it is coded as, if you go in and select analyzed, it's looking at the 5 questions, and this is for the questions that are on the 2.41 data version, the 5 questions that are listed. So for one, let's take surgical procedure for lung cancer or suspected lung cancer. If that's set to yes, or any of those questions are set to yes, that will flag the system to define that case as being an analyzed case. So that's one thing that it's looking at. The question set. The other is it's looking at the procedure codes. So if any procedure code that is selected and is is classified as an analyzed procedure, the filtering will look at the actual code. So non-analyze is basically any of those questions. If those are, if all of those questions are set to no, then it basically filters those cases out. And also if there are codes that are defined as non-analyzed codes. So it looks at that combination. So the filtering, and again, it's posted on within the notification section. If you take a look there, it does have a breakdown of the questions and also the consideration of what type of code is selected as the primary procedure. Hopefully that helps, but we did get additional feedback to fine tune that filtering. And again, I didn't think that the 2.3 version, I believe there's only 2 questions that if we're looking at those cases, there's only 2 questions that are considered within that data version. So the filtering will be a little bit different there based on those 2 questions. And then of course the codes, if non-analyzed codes are selected there, it will use those to do the filtering. Okay.
Thank you, Melanie. Yep. Our next question, can a running list of all notifications, resolution, date resolved, et cetera, be sent to third-party vendors for optimal communication about issues between STS, Iqvia, participant, and vendor?
Yes, and Carmen, you did raise this before, so it hasn't been forgotten. We did get the list, and we will be facilitating, making sure that those communications will go out. But I did, in regards to like the latest notification regarding the patch, that was not sent out to, at least that communication was not sent out to the vendors. It was just posted within the application. So we will make sure to keep that in mind and make sure that we share it out to the distribution list for the vendors also.
Thank you, Melanie. So far, we don't have any other additional questions. If you would like to get your questions in, I'll hold on a few more seconds here. In the meantime, if we're waiting for some additional questions to come in, I just wanted to put back up on the screen the dates for our next webinars. Again, the next monthly webinar is scheduled for May 13th at 1:30 Central Time. And our next user group call, hopefully we will not have as much technical difficulties as I had today, scheduled for May 27th at 2 o'clock Central Time. I'm not seeing any additional questions come in. I didn't know if anyone, Carol or Melanie, if you guys had any other comments you'd like to add before we close today's call. Anything to add?
No, just thanks everybody for joining, and stay safe.
Yep. All right. Yep, I don't see any other questions coming in. So just wanted to thank you guys for your patience today as we got our start, got a little rocky start there. So thank you for your patience and for hanging in there with us. And we will see you all on the next monthly webinar scheduled for May 13th at 1:30 Central. Thank you everyone for joining. I hope you have a great day. Stay safe.